So much for being here because you're truly integral to making this campaign launch a success. We need to spread the word. We need to start talking about shingles. And there's also another group of people I'd like to acknowledge. Thank you for being here. How about a round of applause for our healthcare professionals who are in it to support the campaign as well and to help guide us along. So like I said to my dearest audience members, I hope you're nicely settled in. We're gonna have a nice lunch in a short while. But for now, please lend us your ears. And after the program, usually secret, parang ayaw mo sabihin may ganyan si ganyan. Eh what more kung hindi nga alam na yun pala yung sakit. That's exactly what we're gonna do today. Let's talk about shingles. So later on, after the event, we actually have an action to do. And that is to advocate for a healthier community here in the Philippines. Are we all game for that?
Yes.
Thank you. Wonderful to have you all on board. So without further ado, we begin with the very thing that gathered us here today. Let us unveil the sabi nila, the truth about it. It's one of the most painful experiences ever. That's why the word debilitating, diba? Weak. Talaga parang wala kang magawa. Can you just imagine what that's like? And it's a reality among many, many people, not just in the Philippines, but in the whole world. And it is underestimated because, like I said, not a lot of people talk about it. So let's get the conversation going, shall we? To start off our program, we give you the GSA Philippines Country Medical Director. A round of applause, please, for Dr. Gio Barana.
Good morning. Good morning, everyone. So, sige, tanong muna. Can we raise our hands if any one of you experienced labor pain? Wow, dapat. Or stabbed by knives? Or pierced by needles? O sige, ito na lang. Kahit na violent pinch, kurot, pero more than a month continuously. Ito, I hope not, no? We experience yung chronic cancer pain. But do you know that shingles pain is twice the pain of chronic cancer pain, more than that of the labor pain, worse than arthritis or even surgical pain. I'd like to welcome you to the launch of Shingles Disease Awareness Campaign here in the Philippines. This is the Philippine version. Today we gather and shed light on an often overlooked, totoo naman, and debilitating disease that affects millions of people worldwide. Do you know that 1 in 3 can develop shingles globally? And 9 out of 10 carries the virus in you. For those who had shingles, sabi nila, the pain associated with shingles is often described as the worst imaginable pain. It is a pain that can significantly impact the quality of life for those affected. And that shingles sharply increases at the age of 50. And as the global aging population grows, the incidence of herpes zoster is expected to rise. As I stand here, there are 3 important actions that I want to impart. One is know that shingles is a debilitating disease. That adults 50 years and above are at increased risk of developing shingles. That our immune system weakens as we grow older. We also call it age-related decline in immunity, making us more susceptible in infections. Second action, feel. COVID has taught us that sometimes, or if not most of the time, older adults are more vulnerable in children. And we need to feel as well how pain feels by just looking on those sculptures on your left side. That's the house of pain. And last action is do. I encourage you, our partners in media, to motivate our elderly loved ones, our parents, our grandparents, for those who are 50 years and above, to have conversations with your doctors and ask about shingles. Again, good morning. We are GSK. Like you, our media friends, our experts here, the patients who will share their experiences Each of us is a puzzle piece when joined together makes an impact in creating good patient outcome. Today, we have the privilege of hearing from a well-respected and renowned infectious disease specialist, very famous, especially during COVID days, Dr. Jean Solante. Dr. Solante is the president of the Philippine College of Physicians and previously served as the president of Philippine Society for Microbiology and Infectious Diseases. His expertise and insights will provide valuable knowledge to all of us. Again, thank you for joining us today. We hope that through your platforms, we can all work together to raise awareness, prevent the spread of shingles, and improve the health and well-being of Filipinos. Again, please join me in welcoming Dr. Jean Solante.
Good morning.
Morning.
So, as a doctor here, I'll be here to explain to you and give you additional knowledge about shingles. So, the title itself is quite revealing because we know shingles appears or initially appear as a rash, okay? But it's more than a rash, and I have to justify that with the succeeding information. So these are my disclaimer. So how does shingle will start? Okay. Any one of you here have varicella or chicken pox in the past? Wow, 80%. So it's not only 50%. 80% will have a risk for shingles. Okay, because most of those who had varicella, okay, when you had that virus in your body, that does not go away. It will stay in your body until the time that when you reach a particular age group, okay, 50 years old, some 40 years old, 50 and above, your immune system goes down, and that's why this virus will reactivate. No? So baka magtatanong kayo, saan ba nagtatago yung virus? Napakagaling naman. Yes, it's a very intelligent virus because it hides in our central nervous system. No? Yung nerve, it goes there without, it goes there for a longer period of years. No? And there is a particular vulnerability that virus will reactivate once our immune system goes down. And the most common among that is among those who are 50 years old and above. No? I'm 60 years old, aminin ko, I'm already vulnerable. But any one of you here may be less than 50 years old, that doesn't also exempt you from also being vulnerable if you get chicken pox. Okay, so this is just the data telling you globally. No, so these are data coming from different countries, mostly from Western and European countries, that the incidence of zoster increases with age. So dito makikita mo, 40 years old, 30, meron. But once you are 50 years old, it goes up exponentially. Doble ang risk mo. No? Tumataas yan. And then, you see, 70 to 80 years old, mataas pa rin. If you look at how this pan out in terms of kung meron kang zoster in this age group, 50, 60, 70, 80, you also are prone to develop the complications of zoster, which is the PHN, no? Post-herpetic neuralgia. Later on, I will explain to you what is post-herpetic neuralgia. So, which means na kung magka-zoster ka in this age group, mataas din ang komplikasyon mo that you will have that effect of the zoster even after 3 months or 4 months of having the zoster, no? Yung post-herpetic neuralgia. This is our own data in the Philippines. So, I'm just looking at how age group, which among this age group, ano yung pinakamataas na age group na nag-uumpisa na mataas ang kaso, no? Let's say 50 to 59 years old. Estimated population here is 9 million. How many of those have zoster out of the 9 million? That's 2 million. And that's 24% of cases. If you are in the 60 to 64, around 3 million, that's 707,000, 20%. No? So which means in totality, if you have 18 million from 50 years old and above, then the risk na na-document natin is 21%. That's quite high. And you can just imagine the burden of the disease, the burden of all of these people suffering. You can imagine your Lola, 65, 69, 70 years old, having zoster. So horrible. No? And I have experienced that also with my grandmother. So we thought that age is the most important trigger for the reactivation. But there are also other conditions, especially for those less than 50 years old. Ano ba itong mga condition that can also trigger zoster or your shingles? One is chronic respiratory condition. Tingnan mo yan, it's 30% increase. These are patients that have asthma, those who are smokers, who have COPD or chronic obstructive pulmonary disease, medyo may taas ang risk. Diabetes. I think all of you here know or have friends, or some of us here are diabetic. Even if you're 50 years old and less, basta meron kang diabetes, pwede kang magpa-shingles. Those who had COVID-19 infection, no? I was discussing it with our dermatologist kanina, why there are a lot of these cases now having shingles. Maybe, no? I cannot say that this is really an absolute fact, but if we are just to correlate, yung mga nagka-COVID-19, because of the immune response affected by the virus, yung mga nagka-long COVID, most likely that can also trigger decreased immune response, and when they have exposure to varicella before, that can be a reason why there is also a reactivation. Of course, we have HIV/AIDS, autoimmune disease like rheumatoid arthritis, SLE, the use of steroids, those with chronic renal disease. No? So ito yung mga comorbidities, underlying conditions that you don't need to be 50 years old and above. 18 years old and above, you can have reactivation of your shingles. So how does this manifest? Okay? So merong stages yan, no? Bago mo maramdaman yung mga sintomas na to. The first phase is the prodromal phase. Anong ibig sabihin yan? Prodromal, before the appearance of the shingles rash. Anong nararamdaman ng pasyente? Masakit ang ulo, mabigat ang katawan. Later on, we have testimony from actual patients, no? Walang ganang kumain, as if they cannot totally galaw, no? Their function is really very low. And then they have this abnormal skin sensation doon sa area where the rash later will appear. And then after that, you have the acute phase, which will last 2 to 4 weeks, no? This time, this is the, kaya red siya dyan, because that's where most of the symptoms at natatandaan ng pasyente na shingles pala to. Because you have the vesicular rash, and then mostly, or majority, or all of that is usually one side of the body. Hindi pwedeng dalawa yan, no? Because it involves specific area of our nerve. And then this is associated with severe pain. Before the rash will appear, you already have some tingling sensation or pain, but once the rash appear, doon mas tumataas ang intensity ng pain. And then, later on, after 4 weeks or 1 month, meron pang nararamdaman yan. Okay? Ano yan? Yung tinatawag natin na herpetic neuralgia, subacute, within 3 months. Ano yan? It's like a tingling sensation at the area where you have the rash. Sometimes it's so disturbing, a lot of times, yung pasyente hindi makatulog, no? Hindi makagalaw, and sometimes it has some what we call psychological effect. Sometimes they go into depression. But the most important there is the pain during the time of the appearance of rash. Na yung normal living nila, yung normal function nila daily is also affected. But what we want here to emphasize that your shingles complication can also extend beyond 3 months, no? Yun ang tinatawag natin na post-herpetic neuralgia. You see there, it can be months or even years. And I have a lot of these patients that has post-herpetic neuralgia several months after the event, no? Most of them are the elderly population and those who are immunocompromised. So that's something of morbidity dahil nga marami siyang naramdaman, meron ding daily. Okay, so just to graphically illustrate to you how does the rash of shingles will appear. Ito yun, yung una, the first week, you'll have this vesicular appearance of the rash, no? Yung parang tubig-tubig na merong very definite yung border niya, okay? And then after that, on the second week, that rash or vesicular rash will become yellowish, no? Parang may nagnana, no? Pustular ang appearance niya. And then after that, it will rupture, okay? Dito yan sa week 3, and then you have crusting. And sometimes with crusting, you'll also have an infection sa skin, and you need antibiotic. We give antibiotic para hindi lang magiging severe skin infection. Now, it doesn't end there because once you have the scarring of the crusting, then you also have the scarring. If you have to scratch that, it can also cause yung peklat. Okay? As much as possible, you will advise patient not to touch it, not to scratch it, kasi baka magka-peklat and it will cause some deformity doon sa area ng skin. No? So that's how bad the skin lesions of your shingles. Now, since we emphasize here the importance of shingles is beyond the appearance of rash, what as doctors like me, an infectious disease specialist, when we have patients in front of us with shingles, hindi lang rash ang pinag-usapan. Ano pa? Yung komplikasyon. And some of these patients need to be hospitalized because of that complication. No? As I mentioned, yung post-herpetic neuralgia, this is a pain na hindi ma-describe ng patient, longer duration, no treatment. It can only be abated temporarily with mga pain reliever, but most of the time, it's so difficult to control the pain. Itong herpes zoster ophthalmicus, no? So this affects the nerve ending of our eyes. It affects the nerve ending of our eyes. Kung makikita nyo yan, it may just appear a lesion just surrounding the eyes, but the danger there is that it can also cause blindness, okay, in some patients. No? And that's quite very difficult to treat because if it causes blindness, then there are those that will really not be able to acquire their vision because of the complications. What are the other complications here? It can be causing disseminated disease. One of that is it can also cause inflammation of the brain. No? We call it encephalitis. Okay? Then you have neurological complications. Yung Ramsay-Hunt syndrome is paralysis of half of the face. At the same time, you cannot also your hearing will also be distorted. Okay, we saw some of the patient. Most of these patients are really the elderly population. Then yung Bell's palsy, there is weakness of the one side of the face, and then cardiovascular and cerebrovascular event. No? I would like to just focus on this, no? Yung cerebrovascular disease. How many of you have seen a patient with stroke? Stroke. 1, 2, 3. Do you know that there is now a direct correlation of shingles with stroke? Because the virus can also penetrate the blood vessel where it will transfuse or where it will feed our brain. Okay? So hindi ka hypertensive, hindi yung nag-bleed, hindi. It's not. It's just really about the virus causing that stroke that is so common now among the age group 50 years old and above that they present with stroke. They are not hypertensive, but it's an effect of shingles. Okay, so here this is some of the regional data, no? Philippines, Singapore, Thailand. Now, how common is these complications? Like post-herpetic neuralgia can be as low as 6.3 to 50%. No? Singapore, Thailand, and then you have Philippines. Herpes zoster ophthalmicus, involvement of the eye can be as low as 4.98% to 14.9%. So meaning this is something that we always have to remind everyone. The fear that anyone can get these complications if you will not be able to be managed properly. No? And then bacterial infection, and then proportion of all patients with other zoster complications. Okay. So I would like you to focus on this. Bakit ba natin ito pinapakita? Okay? Because shingles, aside from the complications, there are also impact on the quality of life. And this is a good study. No? This was done in 2010. And I can remember this study was done because this was the time when the CDC was about to approve the vaccine for that, no? To encourage people in the United States to get vaccinated during the time. So look at the reported impact on quality of life. Alteration of sleep is the most common. Hindi nakakatulog ng maigi. Enjoyment of life. How can you enjoy life? When you walk, you have pain. And when you walk also, when you have shingles, you have scar in your face. So it can affect you. General activities. Daily general activities. Your mood. Diba? Sabi ko kanina, we have patients with depression because of the effect of the neuralgia. Normal work is also affected. Relationship with others, no? Ayaw na nilang magpakita sa mga barkada nila o sa yung usual mga group nila because nahihiya sila because daw nagka-shingle sila. And then walking abilities because of the neurological complications. So this is beyond the rash. This is beyond everything that we know about shingles. We need to know what other things that can also impact life. So in summary, herpes zoster is a common, very painful, and potentially debilitating illness. I've shown you the complications of how the virus can impact life, can impact the appearance of because of the rash. So it's more than a rash. No? So there's an urgent need for an intervention because, as I mentioned, there's no cure, there's no treatment, there's no treatment for the control of pain. So paano natin maiwasan? Now, just like other diseases, just like other infections, pinaka-most important pa rin is how can we prevent shingles from anyone getting it, especially the vulnerable population. With that, thank you very much for your kind attention.
And from healthcare practitioners, it will be educational. It'll be something that we can discuss, write about, talk about in a clearer light, and hopefully really later on inspire action to others. Just to recap even what Dr. Gio Caramon was saying earlier, 1 out of 3 people globally get it. 1 out of 3. That's not good. And then 90% of those kind of get some sort of symptom. They don't go to their doctors. They go to Google. Pipicturean nila. Sisilipin nila. Ano kaya ito? So wrong. Let's break those bad habits. Alright? And let's get a conversation going. So later on, we're not just going to have Dr. Solante. I'll also have another doctor. She's a dermatologist. And 2 very, very brave ladies who will be sharing their stories. Ladies and gentlemen, who these 2 ladies are, please watch this.